Men over 60, let me ask you something real. Have you noticed those little changes creeping in, the ones you quietly brush off as just getting older? Maybe you don't wake up feeling as strong as you used to. Maybe your energy dips faster. Or maybe, in those private moments, things just don't feel the same anymore. You tell yourself it's normal, that it's age. But what if those small habits you've had for decades, the ones you never gave a second thought to, were actually working against you? Quietly, slowly, silently hurting your health more than you realize. I'm Dr. David Jarrard, a urologist with over 30 years of experience helping men protect their strength, their vitality, and their confidence well into their golden years. And I can tell you this, most men I meet aren't failing because of age itself. They're failing because nobody ever taught them that the rules change after 60. What worked for you in your 30s or 40s might not just stop working now. It might actually start causing damage you won't notice until it's too late. And here's why this matters to you. After 60, your body responds differently. The same private habits you've done for decades can begin to backfire, affecting your prostate health, your circulation, your sensitivity, even your sense of connection with yourself. These aren't small issues. They ripple out into your sleep, your confidence, your relationships, and even how independent you feel in daily life. That's why today, we're pulling back the curtain. By the end of this video, you'll know the 6 most common mistakes men make after 60 when it comes to self-intimacy, and more importantly, how to avoid them before they quietly chip away at your health, your vitality, and your confidence. But here's the thing, I don't just want to talk at you. I want this to be a conversation. So, if you're here because you care about staying strong, independent, and healthy, comment, "I'm here," below. It tells me you're part of this community, and it helps other men see they're not alone in this. And don't forget, hit subscribe to Golden 70s Health so you never miss out on the science-backed tips that can help you take control of your health in these golden years. Let's dive into the very first mistake, one that almost every man I've spoken with over 60 has admitted to at some point. So many men sit in my office and say, "Doc, I just don't feel the same anymore. It takes more effort. It's like my body is numb." And I always ask them one simple question, how often do you rely on outside stimulation? And almost every time, their eyes drop, not out of shame, but because it never even occurred to them that this habit could be part of the problem. You see, after 60, your brain doesn't process pleasure the same way it did in your younger years. Back then, your dopamine system, the chemical pathway that gives you motivation and reward, was sharp, flexible, ready to reset quickly. But decades of high-intensity stimulation, whether that's through explicit media or constant seeking of more extreme images and scenarios, begins to dull that system. Think of it like a speaker that's been turned up too loud for too long, eventually, the sound distorts. The same thing happens in your brain. Instead of excitement and sensitivity, you get flatness, numbness, and the belief that something inside you has died with age. But here's the truth, it's not age. It's wiring. It's overstimulation. And this is where so many men go wrong. They assume they're broken. They assume that this decline is inevitable. But what's really happening is that your brain has been trained to expect fireworks every time, and when real intimacy doesn't match that overblown standard, it feels muted, almost disappointing. The good news? You can retrain your system. You can step back. You can give your brain and body a chance to reset. Take breaks from artificial sources. Focus instead on slower, mindful touch. Shift the attention away from chasing the peak and back to exploring the subtle sensations your body still offers. With time, sensitivity can return. This isn't about shame. It's about giving yourself the gift of feeling again. And while this mistake has to do with what you use, the next one is even more surprising. Because sometimes, the real damage comes not from what you watch, but from where you do it. Now let's talk about the second mistake, and this one catches more men off guard than you'd expect. Many men, when I ask them where their private time usually happens, admit quietly, "Doc, it's usually on the toilet. And they say it almost casually, like it's no big deal. After all, the bathroom feels private, safe, and convenient. The door locks. Nobody interrupts. It becomes the place where habit takes over. But here's the part most men never realize. That simple choice of posture is quietly working against them. When you're sitting on the toilet, you're hunched forward, your pelvis is compressed, and the weight of your body is pressing down on some of the most delicate structures you have. Circulation to your pelvic region gets restricted. Blood vessels that should be open and flowing freely are squeezed shut. And that means less blood to your prostate, less oxygen to your nerves, less support for the muscles that already grow weaker with age. Think of it this way, your pelvic floor is like the foundation of a house. If you keep putting constant weight and pressure on it, over and over, what happens? The structure weakens. The cracks don't show up right away, but years later, the damage is there. And for men, that can look like dribbling after urination, swelling around the prostate, difficulty fully emptying the bladder, or even a dull ache in the groin that lingers long after the moment has passed. The misconception here is simple: if it feels natural and easy, it must be harmless. But just because it doesn't hurt in the moment doesn't mean it isn't causing harm over time. That hunched-over toilet posture trains your body into a pattern of restriction, and restriction is the opposite of vitality. The solution? Give your pelvic area space to breathe. Change your environment. Instead of sitting in that cramped position, try standing. Try reclining somewhere comfortable. Even small changes in posture can restore healthy circulation, relieve pressure on your prostate, and protect those fragile nerves from damage. Remember, your body doesn't stop responding just because of age, it responds differently depending on how you treat it. Protecting your posture now can make the difference between ongoing frustration and years of strength and comfort. But posture isn't the only silent factor at play. Sometimes, the real problem isn't where you do it. It's how quickly you rush through the experience. Mistake number 3 is one I hear more than almost anything else. Men sit across from me and admit, "Doc, I just get it over with. I don't think about it. I don't give it time. I just want it done." And I understand why. For decades, many men learned to keep things quick, hidden, and discreet. Maybe it was stress, maybe it was fear of being interrupted, maybe it was the habit of treating intimacy as something to rush through. But here's the problem: after 60, that mindset doesn't just get you through the moment, it quietly drains your vitality. When you rush, your body shifts into a stress mode. Your heart rate spikes too quickly. Blood vessels constrict. Instead of calming your nervous system, you send it into tension. And the very hormones that should make you feel good, oxytocin, dopamine, serotonin, they don't get the chance to rise fully. What happens instead? You reach the end, but you don't feel satisfied. You don't feel energized. You don't feel restored. Instead, you feel emptier, more drained, as though the moment took something from you instead of giving something back. Over time, your brain learns a pattern: pleasure equals fast, shallow, disconnected. That pattern doesn't just affect you in private. It bleeds into every part of intimacy. You lose sensitivity. You struggle to maintain arousal. And with a partner, it becomes even harder to stay present. The misconception is that faster is better. That it's safer, less awkward, less embarrassing if it's over quickly. But that belief is robbing you of the very benefits your body still has to offer. Because the truth is, your body is capable of deep sensation, even now. It just needs time. It needs presence. It needs space to breathe. So here's the advice I give my patients: slow down. Let go of the finish line. There's no race anymore. Focus on your breathing. Notice the subtler sensations you might have ignored before. Let each moment stretch a little longer. In that space, your body can actually respond. Your nervous system can relax. The hormones that heal, connect, and restore can finally do their work. This small shift changes everything. Instead of leaving you drained, it leaves you stronger. Instead of disconnecting you from your body, it reconnects you. But rushing isn't the only hidden mistake. Because sometimes, the biggest issue isn't speed at all, it's forgetting about a part of your body most men never even think about. A hidden set of muscles that controls everything from your erections to your bladder control. And ignoring them might be one of the most damaging mistakes of all. Mistake number 4 is one that almost no man thinks about until it's already causing problems. I remember a patient in his late 60s, a former athlete, the kind of man who ran marathons, lifted weights, and took pride in staying fit. He came to me frustrated. He said, "Doc, I eat right. I exercise every day. I still stay active. But something just isn't working anymore." What he didn't realize was that the issue wasn't his strength, or his diet, or even his age. The problem was a set of muscles he'd been ignoring his entire life, the pelvic floor. Now, most men never even hear about the pelvic floor until something goes wrong. But it's one of the most important groups of muscles in your entire body. These are the muscles that sit at the base of your pelvis, supporting your bladder, your prostate, and your sexual organs. They act like a hidden engine that powers your ability to stay firm, to control your bladder, and to feel sensation during intimacy. When you neglect these muscles, the consequences creep in slowly. At first it might just be weaker performance. Then maybe a little leakage, a little dribbling after urination. Over time, sensitivity drops, recovery takes longer, and confidence begins to fade. And the hardest part is, most men blame themselves. They think it's just age. They never realize it's weakness in a part of the body they never trained. The misconception is that exercise means going for a run, lifting weights, or doing push-ups. But you can have strong legs, a strong chest, even a strong heart, and still have a pelvic floor that's completely untrained. And if that foundation is weak, everything built on top of it suffers. The solution doesn't require hours in the gym or complicated equipment. It's as simple as awareness. Practice gentle pelvic floor activations, the same motion you'd use to stop the flow of urine midstream. Engage those muscles, hold for a few seconds, then release. Done regularly, in moderation, this simple habit can restore strength, improve control, and reignite sensation. It's about reconnecting with the part of your body most men never think about until it's already failing them. And yet, even when your muscles are strong, there's another mistake that can quietly undo all of your progress. Because sometimes the problem isn't weak muscles, it's how often you use them. Too much or too little can both set you back. And that brings us to the next mistake. Mistake number 5 is all about frequency, and it's one of the most common sources of confusion I hear from men over 60. Some men come to me worried that they're doing it too often. They say, "Doc, am I overdoing it? Am I wearing myself out?" Others sit across from me and whisper the opposite, "I stopped years ago. I figured I was too old for it now." And the truth is, both extremes can quietly harm your health. Let's talk about doing it too often first. When it becomes a routine done out of boredom, habit, or unresolved stress rather than genuine desire, your body often can't keep up. Over time, that overuse can irritate the prostate, drain your energy, and dull your nervous system. Instead of restoring you, it leaves you depleted. I've seen men lose interest in real intimacy because it becomes less about connection and more about checking off a routine. And when it reaches that point, vitality starts to fade. On the other hand, stopping altogether isn't the answer either. Some men step away completely, maybe because of health concerns, medications, religious guilt, or the belief that past a certain age it's just not appropriate anymore. But the body doesn't see it that way. Just like your heart needs circulation, your sexual system needs movement to stay alive. Even occasional arousal without climax helps keep blood flowing, nourishes nerve endings, and maintains erectile strength. Without that regular stimulation, the system begins to atrophy. Desire fades. Nerves grow less responsive. And what was once simply a choice turns into a real loss of function. The misconception is that stopping is always safer. That abstaining is the healthy path once you reach a certain age. But balance is the key. For most men over 60, once or twice a week, done consciously, slowly, with presence and care, is enough to keep the system alive without wearing it down. It's not about rules, it's about rhythm. It's about listening to your body. And your body speaks quietly in your later years. The art is in learning to hear it. But even if you find that balance, even if you get the frequency just right, there's still one last mistake that can undo all the progress. And it's one I see more often than you'd think. Because when sensation fades, many men try to force it back, and in doing so, they cause real, physical damage. That's the next mistake. Mistake number 6 is one that men rarely talk about, but it's happening more often than you think. I hear it in the same frustrated words over and over again: "Doc, I don't feel as much anymore, so I just grip tighter. I press harder. I try to force it." And at first, that may seem like a simple solution, more effort to get more feeling. But the truth is, this approach is slowly working against you. As we age, sensitivity naturally changes. The nerves in your body, especially in such a delicate area, aren't as quick to respond as they once were. And instead of slowing down, instead of exploring gentler ways, many men push harder. But here's the hidden danger: excessive friction doesn't restore sensation. It destroys it. Think of those nerves like fine wires. They're built to carry delicate signals of touch and pleasure. When you grip too hard or press with too much force, you begin to damage those wires. Micro tears form in the tissue. Scar tissue builds underneath the surface. The skin loses elasticity. Over time, this can even lead to curvature, reduced blood flow, or pain during arousal. These changes don't show up overnight. They build slowly, quietly, year after year. And by the time you notice, the damage is already well underway. The biggest misconception here is simple: that more force equals more pleasure. But pleasure isn't born from pressure. It's born from sensitivity. And sensitivity fades the more you push against it. The harder you fight, the less your body responds. It becomes a cycle of frustration, forcing, pressing, struggling, until the act feels more like a battle than a release. So what's the way forward? Gentleness. Relearning that your body doesn't need aggression, it needs care. A lighter touch allows nerves to recover. Focusing on slower movements, on breathing, on the subtle sensations that are still there, reawakens what force has dulled. It's not about trying harder, it's about listening closer. And when men make this shift, something remarkable happens. They rediscover feeling they thought was gone forever. They stop fighting their bodies and start working with them again. These 6 mistakes may seem small when you look at them one by one. But together, they quietly shape your health, your confidence, and your vitality. And the real danger isn't just the physical changes. It's the disconnection they create between you and your own body. But the good news? With awareness, with small adjustments, you can take that connection back. It's not always easy to hear this, I know. Because these habits, the way you've done things for decades, they feel like second nature. They feel safe, familiar, even comforting. And to suddenly realize that those same habits may now be working against you, that can be hard to accept. It can feel unfair. Like the rules changed, and nobody told you. But here's the truth that I want you to hold on to: awareness changes everything. When you finally see the hidden patterns, you can change them. And change doesn't mean giving up or losing what you've always known. Change means adjusting, so your body can keep working for you instead of quietly breaking down. This isn't about shame. It isn't about loss. It isn't about saying your best days are over. It's about stepping into this stage of life with wisdom. You don't have to stop. You don't have to withdraw. What you do need is to shift. To treat your body differently now than you did at 30 or 40. Because it needs something different from you, not less, just different. So let me encourage you to take one small step today. Maybe it's as simple as standing instead of sitting. Maybe it's slowing down and noticing your breath instead of rushing. Maybe it's paying attention to the quiet muscles in your pelvic floor that you've ignored all these years. You don't have to overhaul everything at once. One small adjustment can start to restore sensitivity, protect your health, and bring back the connection you thought was gone. And here's the most important thing, your best years are not behind you. They are still here, waiting in front of you. With knowledge, with patience, and with a gentler hand, you can continue to enjoy health, intimacy, and confidence well into your 70s, your 80s, and beyond. Your body is not failing you. It's simply asking for a different kind of care. And when you learn to give it that care, you'll find there's still so much life, so much strength, and so much joy left to experience. To bring everything together, let's quickly recap what we've covered today. We talked about the 6 most common mistakes men make after 60 when it comes to self-intimacy. Over-reliance on stimulation sources that dull sensitivity. Sitting in poor positions that quietly restrict blood flow. Rushing through the experience, which drains instead of restores. Ignoring the pelvic floor, the hidden engine of your strength. Falling into extremes of frequency, either too much or too little. And finally, using too much pressure, which damages the very nerves and tissues that give you pleasure. 6 mistakes. All of them fixable, all of them within your control. Now, I want to hear from you. Which of these surprised you the most? Was there one that hit close to home? Maybe you've noticed it in yourself, or maybe you've seen the signs in a friend, a brother, or someone you care about. Share your thoughts in the comments below. Your story might be the exact encouragement another man needs to realize he's not alone and that change is possible. And if you found value in this conversation, if even one part of this video opened your eyes or gave you hope, I invite you to subscribe to Golden 70s Health. This is a space dedicated to men in their golden years, a place where we talk openly, without shame, about the real changes that come with age, and the science-backed steps you can take to stay strong, independent, and confident. By subscribing, you'll never miss the kind of advice that can make a real difference in how you feel every single day. So, thank you for spending this time with me today. Remember, your health is not slipping away, it's still in your hands. Stay strong. Stay informed. And most of all, stay connected to yourself and the life that's still ahead of you. I'll see you in the next video.